In this video, we're going to talk about policy surveillance systems, or at least the very building blocks of how to build a policy surveillance system, and then we'll go through a bunch of examples on what type of information these systems actually collect. So what is policy surveillance? Well, essentially it works like any other surveillance program, and we'll talk about different types of surveillance programs in a different video, but it tracks changes in policies over time. And these policies can be at a national level, a state or provincial level, or even at the local level, depending on essentially the resources and purposes of the surveillance system. But to be useful to the scientific community and really to be useful to inform addiction science and the public health community, it must be done in a scientific, systematic process. It can't just be a random collection of information and we hope something cohesive comes out of it. So there are four basic characteristics of a good policy surveillance system. And really, any surveillance system these can be applied to. One, it needs to be accurate. It would be really hard to conduct good research on inaccurate information. If we think a policy is in place and it's really not, or we don't think there's any new policies in an area when in fact they've had one on the books for years. It needs to be up to date. We need to know what policies are enacted now, not necessarily only what has been acted 10 years ago, or even 5 years ago, or even a year or two ago. We need to be able to see if those policies are still in place, and if not, what changes have been made. So we need as current of information as possible. They need to be longitudinal. This means that the same locations are monitored over time. Just take the US, for example, with our 50 states. It wouldn't really help us if we monitored one state each year for the different policy changes, because we couldn't track any individual state, like how any individual state changed in a short period of time. It would take us 50 years to collect the next round of data. What we need to do is collect information from every state for every year so we can closely monitor and track what policy changes are actually being made. And then finally, a good surveillance system allows researchers and allows anybody who really wants to access to the raw data. If we don't have access to the raw data, or if they're not willing to provide access to the raw data, we tend to question what the system is actually collecting and whether the results in the data they're presenting are actually accurate based on the information out in the population. So 4 characteristics of a good policy surveillance system has to be accurate, up to date, longitudinal in nature, and researchers or other interested parties need to be able to access the raw data that's collected within the surveillance system. So some examples. We're going to go through 5 different examples of good policy surveillance systems that we can use in addiction science. So we could use these systems to basically check whether or not a policy has had an impact. We'll start with the Alcohol Policy Information System, APIS. This is a US system. It systematically collects information on state-level alcohol policies, alcohol control policies. As of 2017, there were 35 alcohol-related policies that they focused on under a variety of different headings, and they update these once a year. So it is longitudinal in nature. It's all 50 states, each one updated each year. It's good quality of access to the raw data, and this kind of goes beyond just collecting the information, because the APIS system actually uses trained reviewers, whether they have a legal background or more of a scientific background, to review the changes in the state laws. So they go one step further in just saying whether something goes up or down, but actually go into the law itself, look at the specific language, and tease out, because sometimes the language is fairly dense, and they tease out what the actual structural changes of those policies will actually be. And by doing so, you can generate maps such as this. This came straight from the APIS website. This is looking at the specific excise tax per gallon of beer per state for as of January 1st, 2016. They didn't have the 2017 data available yet when I pulled this map. And using this data, you could be able to determine if high excise tax states had different health outcomes compared to low excise beer tax states, and on and on. And we'll talk about outcomes again in a different video. But you can draw these maps for each one of those indicators that the APIS system is collecting. Now, tobacco control. So APIS is funded by NIAAA. It's essentially a federal system. Um, Tobacco control laws are routinely monitored by non-governmental systems. So the tobacco control community is very large. It's larger than the alcohol control community. And there are two organizations who have really kind of led the charge, at least from what I could see, in terms of routinely monitoring tobacco control laws here in the United States. You have the American Lung Association and Americans for Non-Smoker Rights. So the American Lung Association, the ALA, they have annual reports for each state. And what they do is they really focus on 5 areas that they think are most important in terms of reducing the impact of tobacco use on health. This includes prevention and cessation funding, taxes, smoke-free laws, secondary smoke laws, access to services, and then legal purchase age laws, which are slowly increasing as more and more states and municipalities look towards 21 years old as the legal purchase age for cigarettes and not 18. Now, the ALA, for these focus areas, they do a pretty good job collecting it. However, this is done primarily for advocacy purposes because they then publish this to kind of like name and shames different states to get them to implement stronger tobacco control initiatives. But on top of these 5 key areas, the ALA also maintains the State Legislated Actions on Tobacco Issues database. So again, it's annually updated. It's a more thorough database of state-level policy actions, and includes more areas than the advocacy reports might include. So they have things like advertising restrictions and liability laws, and other areas that could be of interest to tobacco control researchers and policy creators. But if you're interested in tobacco control policy, it may be more useful to contact the Americans for Non-Smokers Rights, because they also maintain a database of tobacco control laws in the U.S. These records go back over 100 years now, and they don't update them yearly, they actually update them quarterly. And they get their information directly from elected officials, from news reports, and from their own members. So they get them from a variety of sources, so you can kind of triangulate the information to really zero in and settle down on what has actually occurred. Because of the comprehensiveness of this data set, again going back over 100 years, how often they updated it, and the fact that they collect both state and local laws, this system by the Americans for Non-Smokers Rights is actually more useful if you're interested in conducting research. Now, marijuana policy. We need surveillance systems for marijuana policy. We've needed these since the spread of medical marijuana laws. We need them especially now with the introduction of recreational marijuana laws. Excuse me. And there's a couple systems that track these. So marijuana laws are tracked by the Policy Surveillance Program, which is funded by the Robert Wood Johnson Foundation. So it's headed up by Temple University, but it has essentially private funding. There's also marijuana laws are also tracked by the APIS system, which tracks alcohol control policies. In many areas, in many states, they're regulating marijuana as they would regulate alcohol, so it's kind of easy for this system to just simply double up. Both of these track recreational marijuana laws. Medical marijuana laws are typically tracked by prescription drug abuse policy systems, and we'll talk about that in a couple slides. So here's an example of the type of information from the Policy Surveillance Program. Again, this is funded by the Robert Wood Johnson Foundation. This data, again, it's a little out of date, so it's not like it's very robust data, but what they allow you to do is they do give you access to the raw data. They allow you to make these maps and charts so you can kind of see what's going on in kind of geographic distributions, and they give you some level of specificity. So in 2015, which was the last year this information was available for this criteria, I selected which states have a law authorizing recreational marijuana and which states have consumers pay a marijuana-specific sales tax. And of those, it was Colorado and Oregon. Now, Washington also has a recreational marijuana law. Now, as of 2017, other states have recreational marijuana laws, particularly Massachusetts had one. I know that because I voted in that election. But through this system, you not only get whether marijuana is legal recreationally, but you can also identify the other attributes of the law, which may not be very apparent, but which may be very important in terms of marijuana control policy. And here's the prescription drug abuse policy system. This is more than just prescription drug monitoring programs. These are a set of programs that are focusing on essentially prescription opioids and prescription marijuana. It's funded by NIDA, and they're trying to provide information on these important policies that promote the safe use of controlled medicines. Essentially, they're accepting that these medicines can be abused and are abused on a regular basis, so they want to put systems like this in place so that we know where the problems are and where can we dispatch the resources most effectively. And this system focuses on 4 key policy areas. One is access to naloxone, which is specific for opioids. 2 is Good Samaritan laws, so are people on the street able to help others in need without being legally liable or with being legally liable. The prescription drug monitoring programs, which monitor primarily the use of opioids by physicians and patients, how many physicians are actually prescribing them to which patients. These are really good programs. They really work. It's a discussion for another video. But I will say at the moment that most of them lack the ability to talk to other states. So it's state-specific systems, which is the one drawback from them. And then they focus on where there are medical marijuana laws. And finally, let's talk about, so all of those systems were at the state level here in the United States. With the World Health Organization, with their Global Health Observatory, they're essentially doing the same thing, but at the national level. They've created this clearinghouse for national laws around the world, and it contains a lot of information that can be very useful in addiction science. So there's information on alcohol policies, on substance use policies, and on tobacco policies, as well as outcomes related to the use of those different substances. And just like the state and local level systems here in the United States, this Global Health Observatory can be used for policy creation and to determine whether a policy has been effective or not. Now, just knowing a policy in place may or may not be good enough to make sure that an outcome is actually achieved. What really is needed is some way to code these policies to determine whether it's an effective policy or not. So whether putting a specific sales tax on recreational marijuana products is an effective measure, we really need to know, at least policy-wise on the public health addiction science side, we need some process to code it in terms of being able to determine whether that's more or less effective at curbing marijuana use than other policies that could be there. The problem is that this is really a resource-intensive process. The Nelson et al. Paper took a lot of resources. It took a very long time, much longer than they thought. It was this iterative process using 10 to 12 international experts in the field where they rated different policies multiple times to build consensus in terms of what policies can be effective for alcohol compared to others. And what it does is it creates charts like this, which may or may not be useful depending on what your purpose is, right? It's just kind of asterisks, stars, different codings, but there's no numerical values. It's just kind of like a 1, 2, 3 system, and there's no more specificity than that. But by doing this rating system and by having this consensus of experts, it makes it easier to see that things like for youth binge drinking, zero tolerance laws are much more powerful, much more effective than nutrition information labels. So we can use these policy systems, and if we can code these policies, we can kind of do a quick screen for which areas may or may not have higher or lower prevalence of substance use problems. So, did Connecticut make the grade? These are the results of the American Lung Association's advocacy efforts in tobacco control. And I use Connecticut as an example because this is the University of Connecticut. That kind of made it the most sense to me. So in terms of policy effectiveness, this is kind of the short version. I don't know exactly what methodology the ALE uses. But they've consistently given Connecticut a D or an F in terms of their tobacco control policies. We don't spend enough on prevention and cessation. We don't have a tobacco 21 law yet. We don't have good access to cessation services. And our smoke-free air laws are kind of okay. It could be a lot stronger. So in terms of the advocacy side, this is a very useful system because it's really easy to recognize whether a state is doing something good or bad.